Today is August 21st, 2023. The time is 9:20 a.m. I would like to share my thoughts on the coronavirus and take us down memory lane as to what's going on here. I'm going to start with the Bill and Melinda Gates Foundation collaborating against COVID-19, a timeline. I'm just going to hit on a few points. In January 2020, as details began emerging about the potential global threat of a novel coronavirus, we're going to highlight coronavirus. The Bill and Melinda Gates Foundation pivoted its work and resources to help address what would become the biggest public health crisis in over a century. Since then, we have spent US $2 billion to help the world contain and defeat COVID 19, with a particular emphasis on helping vulnerable populations, strengthening health systems, spurring necessary innovations, and trying to ensure equitable access to vaccines, drugs, and diagnostics. While not all our investments have panned out as we'd hoped, we've taken risk to respond as quickly as needed and, like everyone, have often had limited information about new outbreaks and developments. We are proud of the response our hardworking team of more than 1,700 staff members across 9 global offices has put forward, and of the many partners we have worked with worldwide to confront the virus and mitigate its many impacts on global health. We're focusing on coronavirus. Coronavirus. And then I just found this page at random, the Yale Medicine. I like the colors, green, yellow, right, whatever. Coronavirus. Term describes a family of virus, what? Common in both animals and humans. The term describes a family of virus common in both animals and humans. Examples include SARS, MERS, SARS-CoV-2, the COVID-19 novel coronavirus. In most cases, there are no treatments, but rest and over the counter medications can help. Involves infectious diseases. People following the news about SARS-CoV-2, the coronavirus that causes COVID 19, might think coronaviruses are a new disease. In fact, doctors first identified coronaviruses in 1960, and there are now 7 known coronaviruses that vary in severity. All coronaviruses have the potential to cause respiratory illness. For some, that could be as simple as the common cold, while others are much more serious. COVID 19, which was categorized as a pandemic in 2020, has sickened millions of people around the world and is causing a growing number of deaths. There are no cures for coronavirus. So, as is the case whenever a new threat emerges, it's important to follow a specific public health recommendations. Doctors advise taking the same precautions you would to avoid a cold or flu, including meticulously hand washing, and being cautious around people who are sick. Mitigation efforts to stop the spread of SARS-CoV also have included the use of masks and social distancing and maintaining a 6 foot distance from other people. There are no cures for coronavirus. Yale Medicine is telling us that coronavirus term describes a family of viruses that are common in both animals and humans. Origin of SARS-CoV-2, March 26, 2020. World Health Organization. The current global COVID-19 pandemic is caused by a coronavirus named SARS-CoV-2. Coronaviruses are a large family of viruses, several of which cause respiratory diseases in humans, from the common cold to more rare and serious diseases such as the severe acute respiratory syndrome. SARS-CoV-2 is a coronavirus. It's common. It's common in both animals and humans. According to Yale Medicine, there are no cures for coronaviruses. Okay? There are no cures for coronavirus. So, why are we reinventing the wheel? We know that it's being told here that there are no cures for coronaviruses. They're common in us. They're common in humans. They're common in animals. What was the need for something that is so common in man to call it a pandemic? Why did the World Health Organization make an issue of the common cold? Coronaviruses are common. They're common in both animals and humans. There's no cure for coronaviruses. Why was there a need to lock down the entire country, the world, and force an experimental vaccine on the public when we're dealing with a coronavirus, which are common in both animals and humans? I'm going to leave it there.